So the next video I'm going to be assessing what if I suspected a patient of having golfer's elbow or some MCL insufficiency. Just relax, I got you. So for palpation, I'll first be palpating for the common flexor tendon. So coming off of the medial epicondylitis, I'll go just distally where I feel that bundle. Tender, isn't it?
A little bit.
Well, you are a golfer, so that makes sense. So I'd be assessing for any kind of reproduction of symptoms or any tenderness with that common flexor tendon, which this patient here says that he's feeling. If I go just posterior to the medial epicondyle, I'm now in the range of the UCL, that ulnar collateral ligament, which we'll get to testing later. Range of motion, the common flexor tendons are in charge of wrist flexion. So just bring your wrist up for me, as well as some supination. So palm up, and then don't let me move you. Okay. This should be an interesting test then. So for testing for golfer's elbow, what we can do is essentially a medial epicondyle version of the Cozen test. So I will have my patient extend his elbow and extend his wrist and just checking for any reproduction of symptoms. And I can also push him into pronation and then have him push into my hand. And checking for reproduction of symptoms. And if I would get any kind of the pain that the patient would be describing, we would know that it would be positive for golfer's elbow. And now for testing for UCL insufficiency, I'll have the patient just relax, and I'll be applying a valgus strain on his elbow, checking for any reproduction of symptoms and just laxity of his UCL, and also check for end feel. If it was a empty end feel, it'd be a grade 3 instability, and then I can move him up and do a little bit of flexion and repeat that process. Any symptoms? Okay. And again, just for passive range of motion. And then for a mobility test, for wrist, we could do a little bit of some posterior gliding. As with flexion, it's a posterior roll and a posterior glide, so just relax, I got you. This I would check for just any pain that might be radiating up that arm. And then maybe for a mobility for the elbow, we would do a posterior glide. So just pressing in, seeing if it's reproducing any of those symptoms.
Yeah, right there.
And that's how I would assess for a medial epicondyle itis or UCL insufficiency.